Hello, and a very warm welcome to our channel. Today, we are going to have a very serious but incredibly important conversation. It's a topic that can feel frightening, but one where knowledge is truly our most powerful shield. We are going to talk about strokes. A stroke can happen suddenly to anyone at any age, but the risk does increase as we get older. Knowing the early signs and, most importantly, knowing exactly what to do can be the difference between a full recovery and a life-altering disability. In this video, we will calmly and clearly walk through 3 of the most common early warning signs of a stroke. We will learn a simple, easy-to-remember tool that can help you identify a stroke in yourself or a loved one in seconds. This isn't about creating fear. It's about replacing fear with confidence and a clear action plan. This is one of the most important health lessons any of us can ever learn. A critical disclaimer before we begin. This video is for educational purposes only and is not a substitute for professional medical advice. If you suspect you or someone else is having a stroke, you must call for emergency medical help immediately. Do not wait. Before we can recognize the signs, it helps to understand what a stroke actually is. The simplest way to think of a stroke is as a brain attack. It's very similar to a heart attack, but it happens in the brain. Our brain needs a constant supply of oxygen-rich blood to function. It gets this blood through a network of arteries. A stroke occurs when this blood supply to part of the brain is suddenly interrupted or cut off. There are 2 main ways this can happen. One is an ischemic stroke. This is the most common type, accounting for about 85% of all strokes. It happens when a blood clot blocks an artery leading to the brain. You can think of it like a blockage in a pipe, stopping water from getting to a part of a garden. 2 is a hemorrhagic stroke. This is less common, but can be more severe. It happens when a blood vessel in the brain weakens and bursts, causing bleeding into the brain tissue. This is like the pipe bursting, both stopping the water flow and flooding the garden, causing damage. In both cases, the result is the same. Brain cells are deprived of oxygen and begin to die within minutes. This is why acting fast is so incredibly critical. Now, how can we possibly remember the signs of a stroke in a moment of panic? Thankfully, medical professionals around the world have developed a very simple and effective tool. It's an acronym called F.A.S.T. Each letter stands for a specific sign to check for. The 3 signs we are focusing on today make up the first 3 letters of this acronym. We are going to go through F, A, and S one by one. The final letter, T, is the most important action you must take. Learning and remembering F.A.S.T. is a skill that could one day help you save the life of a family member, a friend, a neighbor, or even yourself. The first letter, F, stands for face. One of the most common and visible signs of a stroke is a sudden weakness or drooping on one side of the face. What does this look like? It might appear as if one side of the person's mouth is sagging. The natural fold between the nose and the corner of the mouth might disappear on one side. Their eyelid might droop. It can be subtle, or it can be very noticeable. Here is the simple test you can perform. Ask the person to give you a big smile. When they do, look closely. Is the smile symmetrical? Is it even on both sides? Or does one side of the face not move as well as the other? An uneven smile is a critical warning sign. You are not looking for a perfect Hollywood smile. You are looking for a sudden, new asymmetry that wasn't there before. The second letter, A, stands for arm. A stroke often affects one side of the body, and a sudden weakness or numbness in one arm is another key indicator. The person might complain that their arm feels heavy, dead, or that they can't feel it properly. They may suddenly be unable to pick up an object they were holding, like a coffee cup or a newspaper. Again, the key is that this happens suddenly and typically affects only one side of the body. Here is the simple test for arm weakness. Ask the person to close their eyes and raise both of their arms straight out in front of them as if they are holding a tray. Hold for about 10 seconds. Watch their arms carefully. Does one arm begin to drift downwards? Is one arm unable to raise as high as the other? This downward drift is a classic sign of one-sided weakness caused by a stroke. The third letter, S, stands for speech. A stroke often occurs in parts of the brain that control language and our ability to speak clearly. Therefore, a sudden problem with speech is a major red flag. This can show up in a few different ways. The person's speech might become slurred or garbled, as if they are drunk when they haven't been drinking. They might have trouble finding the right words, or might use strange or inappropriate words that don't make sense in the conversation. In some cases, they may not be able to speak at all, even though they are clearly trying. Here is the simple test for speech difficulty. Ask the person to repeat a simple sentence. It can be anything. For example, the sky is blue. Or, to make it local, something like, the weather in Vienna is lovely today. Can they repeat the sentence clearly and correctly? Or is their speech slurred, strange? Or are they unable to say the words? We have now covered F, A, and S. If you see even one of these signs, you must immediately act on the final letter, T, which stands for time to call for emergency help. This is the most important part of the entire video. Time is brain. I will repeat that. Time is brain. For every minute that a stroke goes untreated, an estimated 1.9 million brain cells die. The faster a person can get to a hospital and receive specialized treatment, the better their chances are of survival and a good recovery. Do not hesitate. Do not wait and see if it gets better. Do not call your family doctor first. Your first and only call should be to emergency services. Here in Austria, the number for an ambulance is 144. Commit that number to memory, 144. When you call, tell the operator that you suspect a stroke and describe the signs you are seeing using the F.A.S.T. acronym. This will help them dispatch the right kind of help immediately. In a moment of crisis, myths and misinformation can be dangerous. Let's bust a few common ones right now. Myth number 1. Let's just wait a few minutes and see if the symptoms go away. This is the single most dangerous mistake you can make. The symptoms might fluctuate or even temporarily improve, but that doesn't mean the brain attack has stopped. Every second counts. Waiting wastes precious brain cells. Myth number 2. A stroke is always dramatic and involves severe pain. Fact, while some strokes can be painful, especially the hemorrhagic type, which can cause a sudden, severe headache, many strokes are completely painless. The person may just seem confused or a bit off. The absence of pain does not mean it isn't a serious emergency. Myth number 3. It's faster if I just drive them to the hospital myself. Fact, never do this. Paramedics in the ambulance can begin life-saving assessments and care immediately. They can monitor vital signs and communicate with the hospital, so a specialized stroke team is ready and waiting the moment you arrive. They also know which hospitals are designated stroke centers with the right equipment and staffing. Driving yourself wastes time and is unsafe. I want to share a quick personal story. A few years ago, I was chatting with my neighbor, Mr. Huber, over the garden fence. He was a cheerful man in his early 70s. In the middle of a sentence, his speech suddenly became jumbled and the corner of his mouth drooped. He looked confused. My mind immediately flashed to the F.A.S.T. acronym I had learned in a first aid course. I saw the face and the speech signs. I didn't second-guess myself. I calmly told him I was calling for help, and I dialed 144. The ambulance arrived within minutes. It turned out Mr. Huber was having an ischemic stroke. Later, his doctors told his family that because he got to the hospital so quickly, they were able to administer a treatment that broke up the clot. His recovery was long, but it was far, far better than it would have been if we had waited even 30 more minutes. It's a day I will never forget, and it proved to me the incredible power of knowing these simple signs. Have you ever learned about F.A.S.T. in a first aid course? It's a skill we should all have. Let's quickly recap the most important information you have learned today. The key to identifying a stroke is the acronym F.A.S.T. F is for face drooping. Is one side uneven? A is for arm weakness. Does one arm drift down? S is for speech difficulty. Is their speech slurred or strange? T is for time to call 144 immediately if you see even one of these signs. Your call to action today is not about food or exercise. It's about making a promise. Promise yourself and promise your loved ones that you will never ignore these signs. Promise that you will never wait and see. Promise that you will always act F.A.S.T. Please share this video with at least one person you care about. Put the number 144 somewhere visible in your home. This knowledge saves lives. If you found this video valuable, please give it a thumbs up and subscribe for more important health information. And one last time, our most critical reminder. This video is for educational purposes. For any suspected stroke, call your local emergency services immediately. Here in Austria, that number is 144. Thank you for taking the time to learn this life-saving information today. Be well and be prepared.